show, right? Yeah. Hi, this is Molly from Onward, and today's guest is Amanda, and she is someone who is on the journey with ovarian cancer, and I thought she'd be a great person to gab with because she's another person on this amazing adventure with cancer. So, all right, tell us a little bit about your health issue, and tell it to me like I'm someone who has no idea what it is, and yada yada.
Okay, sounds good. So for me, I'll kind of tell you a little bit before it all started. I was regularly going to the doctor for just kind of feeling like something was wrong. I knew something was wrong, something was off, and I was, working all the time, felt like fatigue should have kind of been normal in my life, like, oh, I'm tired because I'm working too much, or things like that. And I would sometimes have these really bad abdominal pains that would mean that I was in my bed in the fetal position for like 30 minutes. And I was in my 20s at the time, so I thought, oh, it has something to do with my period or ovulation or all those mysterious women things that people tell us hurt in different ways. And so when I went to the doctor, it was a young male doctor, and he would always say, well, I tested this and I tested that, and there's just nothing wrong with you. And so I would always leave his office feeling like a hypochondriac and feeling like, well, it's just me. I'm a crazy woman who doesn't know what's going on with her body, right? And what actually was happening, I didn't find out till almost a year later, and it was a really crazy day. I was going to present at a big conference in my field.
I remember you telling me about this, yeah.
So I was in Denver. I lived in San Francisco at the time, and I was in Denver, and I'm picking up my bag to go downstairs to get ready to do my presentation. And as I reach for my bag, I bend over and I feel the worst pain ever. Like, such a horrible pain that it either had to stop very quickly or I knew I was going to pass out. Right? It was so terrible. It just take your breath away. Like a 10 on the pain scale. So I always say when people ask me how bad my pain is.
You know what the 10 is now. You know what the 10 is.
Because some people say higher numbers because they don't know what a 10 is.
That would be me. I have no idea what a 10 is.
I totally know what a 10 is. And so I basically ended up, instead of being the girl that did her presentation that morning in Denver, I was the girl who got taken off in an ambulance to a random hospital in a city I wasn't from. And they kept giving me painkillers, and I was still in this terrible pain, and they were giving me all this IV morphine and stuff, and they're like, how is she even awake, much less still in pain? And they thought, oh, it's appendicitis, it's kidney stones. Those are the first things that they guess. But eventually they think to give me a vaginal ultrasound, right? And so that's the kind that they stick the probe up inside you and they're looking around. Not the kind you just stick on your belly like that. And as they do that, they see, oh, so what I had was actually an ovarian torsion, which is where your tube, right, your tube has the ovary on the end, and my ovary had twisted around itself so that it was cut off blood flow, right? So the pain was that my ovary, this one ovary that was twisted, was like dying of gangrene.
Oh my
So
gosh.
you can kind of imagine, oh yeah, that hurt like crazy. And so what they said was there was this emergency surgeon, and he was just going to do some very little laparoscopic cuts in my belly, go in, untwist it, there you go. You'll probably be back to the conference even before it's over. And instead, I woke up, I have not very good eyesight without my contacts in.
I feel ya.
You understand that?
So,
for surgery, they make you take them out.
Yep.
Right? So it's always bizarre to wake up, and also you're wondering how you are, but you also can't see anything.
For sure.
And so I wake up, and this nurse comes over to me to take my vital signs, and she says, I'm so sorry to hear you have cancer. I was like,
Well,
and I didn't even say anything because I was so stunned and confused, and nobody had even mentioned that cancer was a possibility. So I wake up from this surgery, and I'm completely alone, and I can't see anything. And the date is 8/8/08, which will
Stick with you.
Yeah, I'll never
forever.
forget, right? Which happened to be the opening day of the Beijing Olympics at the time. 8s are lucky in China, so they made it 8808. And basically, she said, "Oh, look, the opening ceremony's on TV." And there was supposedly, I couldn't even see the TV, much less what was on it, because I had no contacts in, and it was really far away. And so I'm forever, like, have also connected the Olympics
To your diagnosis.
to cancer and diagnosis.
You didn't even know what your diagnosis was at that point.
No.
You're like, I what?
No.
So then what after that? Like, what were you, like, what?
Yeah.
Did the doctor come in later, or what, did you figure it out, or?
So over the next couple of days, kind of, because I found mine out in an emergency, I kind of never had that scary time that so many
In between.
people with
When you're
cancer
waiting.
have. Yes, I never had the, oh, they're doing a test and we're going to wait and figure out what it is. They actually did like a little frozen pathology right when I was open on the table, because what happened actually was the surgeon freaked when he opened me up. And they actually had to open me up all the way. And while I was out cold on the table under anesthesia, he called my husband, who called my mom, and on a conference call, the three of them decided, okay, we'll leave her some girl parts left, because we were trying to get pregnant at the time, right? So we'll leave her some parts in there a little bit, but we're going to take out, this part that was really bad. And it ended up that I had to then, over the next week and a half in the hospital in Denver, kind of figure out, okay, what really is this? They had to, of course, send the pathology off to some fancy pathologist to check it out. And then finally they came back with, okay, this is a certain rare type of ovarian cancer. And I was 29 at the time.
That's what I was just going to ask you. So you're 29. Now, how old are you now?
39.
39. So what kind of journey has that been? So what kind of, what kind of treatment did you go from? And it does have a certain name, your type of cancer? Give me some of those details.
Okay, perfect. So ovarian cancer is, I have a type of epithelial ovarian cancer, which is just a certain kind of epithelial cell. And in the beginning, mine was called borderline, which also is like, oh, so maybe that's like not really bad cancer because it's borderline, right?
Is it is it staged?
It gets staged. I'm 2C.
2C
At this point, and so it was 2C, and then it became 3C at a later occurrence, and then now I'm kind of in this weird limbo of we don't exactly have all the answers, because to figure a lot of the things out that are going on with me now, I'd have to do other biopsies, but that would put the clinical trial that I'm in at risk.
Oh, kind of like what you were saying about the bubbles.
Yes!
The bubbles.
So I have these bubbles
in my brain.
in my brain.
And that's how I met her, actually, because she has bubbles in her brain.
Totally. And I was told, well, you have to know Molly because she lives near you and she knows about brain stuff. And it was really comforting, because I think one of the things that we don't think about a lot is, this cancer stuff is so complicated, and it's so awesome to meet people around the same age, especially those of us that are kind of in that weird in-between age group where our parents aren't taking care of us anymore, and it's a complicated time in our lives, and we're not kind of in the part of our lives where everything's all figured out. We're still in the changing part.
And you still even know, you're having to make those decisions, do I still want children? Can I have children? Do I want children but can't have children? Am I going to live long enough to have? It sounds, a lot of people are like, oh, don't think that way. But it's also like, no, I'm just being not religious. I'm being practical.
Yeah.
I'm trying to think really realistically about, what's ahead, and it makes you think differently.
Hasn't it made you think differently?
Yeah. Well, we were just talking about this on the car ride here. It was just being more positive generally as a rule. Other than having a tantrum over not finding a shoe. But you can tell me, your diagnosis is terminal and I'll be fine. But telling me that I can't, I have to go somewhere and I can't find my shoe might cause a meltdown of epic proportions, and with tears coming out because my headphones aren't working, when I'm on the treadmill. But you're dying, yeah, okay. But
Totally.
Can't find my headphone is broken.
It is weird to be one of those people our age who talks about death regularly, because so few people do, and even like the sense of understanding your own mortality is so rare in somebody under 40 especially, that I think we find each other sometimes.
Yes.
Because it's real.
It is real, and it's actually fascinating, and I feel like if you can come to terms with it as a thing we're all going to do, if you can come to terms with it sooner, then you don't have to obsess about it and be so sad about it. You're just like, okay, this is a thing that's happens to us all. I'm just prepping for it now. It's really interesting. Do you want to talk? You were in a long-term relationship.
Yeah.
You were married when you were diagnosed. So I know a lot of people where that will affect
absolutely
your relationship when you have a diagnosis. A lot of relationships do end.
Yeah, and mine did, and it's actually a lot more likely that if you're the woman with cancer, that your relationship ends than if you're the man with cancer in a heterosexual relationship, and that's really unfortunate. So I feel so grateful and excited whenever one of my friends has a really great relationship with somebody that has cancer.
Yes.
I just feel so excited for them, and because it's something that partnership can help so much. But what I've really learned is it's never one person that's your caregiver. We all need to be part of the village and the community. And so, like, when I met Molly, I immediately was like,
You were like,
I'm in your village. Let me help you too, and you can help me, and we can like not be isolated in the way that this can isolate you. And so for me, I should have kind of known right at the beginning that my husband wasn't going to be able to deal with this very well. He showed up at the hospital in Denver. He flew out that night that I, was in surgery. And he showed up at the hospital, and he was there for like 10 minutes, and then he said he was going to go back to his hotel. And I was like, back to your hotel? Like, you already checked in a hotel before you came to see your wife who just found out she has cancer, and she's alone in the hospital in a city she's not from? Okay. I mean, I knew that sounded really not supportive at the time, and I didn't kind of understand that, even though he couldn't really talk about it and deal with it and, wasn't getting counseling or things like that throughout the challenging times that we had, I didn't kind of realize that was so dangerous and so hard. And it was something that I wish, I know that I'm way better off that we're not together anymore, and that was a good thing. But I really wish I'd been more conscious of figuring out how to help him support himself and how to help get him the support he needed. But honestly, like, when you're the one who's sick, you have to focus on, there's so many.
You're also so narrowed down to where, like, it's only everything that's happening in your world at that moment that you're thinking about. Because especially that first year or so, like,
Absolutely.
That was so overwhelming. Like, you go from thinking you're completely normal and then having everything kind of crumble around you. You become even more self-obsessed in some way. You can't help it. You're
focus.
You everything is different at that point.
Yeah, just it changes your life. And so I think it just, it ended up being something that over time, it was, then we had fertility challenges because we were still trying to get pregnant, and we ended up getting pregnant but then miscarrying. And so we were never able to have kids together. And I totally understand him needing to move on and having kind of a tough ending to our marriage and stuff. But we were friends for quite a while. He's now remarried, and I haven't talked to him in about a year, and that's hard for me because I really wish I was able to like maintain the friendship, because I put a lot of effort into having a positive relationship with him and stuff. But I think it's just, you can't kind of underestimate how important it is to actually have a dialogue about this stuff, whether it's any kind of caregiver and somebody who's sick. And you you have to think about and talk about mortality and future and plans with somebody you're that close to.
It's hard too, because often it's not the person who's sick that wants to avoid talking about it. It's the other person because they feel uncomfortable, or they just don't. It's actually sometimes I think actually harder on them than it is on the person who's sick sometimes. Because you're like, I want to talk about this. You're like, oh, okay, this is making it awkward. And so you have to kind of get used to like making things awkward for people, which I'm an old expert at.
Actually, that inspires me a lot about you so much.
Really?
Oh, no, because absolutely. Because it wasn't until I got cancer the third time that I even really acknowledged it in public or was visible about my cancer. I mean, it literally, the first 2 times, because of the way that my family is, I mean, I don't even know if like certain extended family members had any idea, ever knew. I would be in conversations like at Thanksgiving or something, and somebody would be talking about somebody who broke a hip or somebody who had the flu for a week or something, and I would be sitting there like,
it's hard not to roll your eyes. So you're like, it's hard because it's like I'm trying to show empathy for other people because their problems are not my problems are not their problems, and it's different. We all have different life journeys, and sometimes though someone's like, this allergy's really bad today. I'm like, oh, yeah, that's bad. I'm sorry you're feeling that way. I'm dying. So you're like, oh, it's okay. I'm not technically dying, but sometimes if you're me, you want to throw out that drama llama right there, right then and there. Yes. and you're like, neuro-oncologist is like, no, not right now. Probably not. And then I'm like, am I really inaccurate? But then I look back and then I'm like, oh, then I look at, I did qualify for disability for a reason. It's not because
Absolutely.
They're not, I'm not gonna get better. And then that makes people really uncomfortable too. And like, they think, we were just talking about, think positive. You're like, I am really, really positive. I'm just trying to be practical too, which is hard.
Well, you are, and I think what I clicked for me, and it just took a lot longer than it did for you, which is why you inspire me a lot, is it took me a long time to figure out that me being visible meant that I made other younger people with cancer visible. And for me, all of us being visible means that we have opportunities for better policy to be made to help us all. That I'm a very politically active person, and it's amazing how many things really affect like my life and death. And all of us.
Well, and I think it's like for, a lot of older generations don't want to talk about it, and that's fine because there are reasons for not wanting to talk about it too, and it's not for everyone. But also not talking about it, I think, is problematic too. So if you're one of those personalities that can and wants to talk about it, you should. And I, not just like mortality, but what it feels like, you should be honest about it. Like not always like, oh, I'm fine. If you're not fine, talk about it. Talk about it with your medical team. Talk about it with your friends. Talk about it with your family. Because ultimately, all this information can help not only like understanding of what a diagnosis, like what it feels like to have this, what chemo does, what a certain diet does, what your medication causes. It can all help. And if we aren't open about it, if we aren't telling our doctors, there's no way they can know. Like if you're having really bad like leg cramps and that's a side effect of something, then you should tell them, because even if you think it's silly, like that could be really important. That might mean you have a blood clot. That might mean any number of things. So I feel like it's so important.
One of the most important things in the work that I do now is, and I say work, it's as a volunteer and it's cancer related, and so these are the things that, because I have very little control over how I feel and over my bodily functions, as it were. Mine's especially challenging digestively because I've had so many major abdominal surgeries and they keep resecting pieces of my colon. So it's literally like digestive things. Peristalsis, the part where the muscles are supposed to move in your colon, doesn't happen if the surgeries were too close together, right? So all my system just is very complicated how it works. And so I don't have a lot of control over when I feel good or when I feel terrible and when I can get out of bed and when I can't. And so I'm really lucky I get to do some things around cancer that if I have to back out, people totally understand
Sure.
because it's the reason.
They get it.
Yes, they're all cancer people, right? Cancer people. And so one of the things I do is I teach. It's called Survivors Teaching Students, and it's particularly about ovarian cancer because it's such a silent disease. We used to say silent, and now we just say it whispers. It's just quiet. There are symptoms, and so the 4 main symptoms that I just want to say because they're so important
Sure.
for us to be aware of. There's 4 main symptoms that happen more often in women who have ovarian cancer, and you can get ovarian cancer at any age. We know people who, as babies and as young
Gilda
children.
Radner. That's a
Yeah, Gilda Radner, very famous. And one of her comedy colleagues, Madeline. I can't think of her last name. She's so funny. Another comedian of her same generation also died of ovarian cancer too. But it can be little kids, it can be much older women. You don't even have to have ovaries anymore to be able to get ovarian cancer. So you could have had a hysterectomy, and it's just called primary peritoneal cancer, but it's the same as ovarian cancer. It's treated the same way. And so the 4 main symptoms are bloating, feeling full quickly, like you eat, and you only can have a little. Any urinary issues, like whether you have to pee a lot, or you can't pee, or you got to pee all the time. And then the last one, bloating, feeling full quickly, urinary issues, and then abdominal pain or pelvic pain. And so if you have 12 or more days in a month where you have any one of those symptoms or all 4, whatever, then you just go to your gynecologist. So yeah, it's like, don't panic, just go to the gynecologist. And so that'll kind of start them in the right place looking, and just being able to check you out and help you, because unfortunately, the reason so many women are still dying of ovarian cancer, a lot of it is because people get diagnosed so late.
They don't know. So ovarian cancer, much like a brain cancer, if you have it in a certain part of the brain, you aren't going to know you really have symptoms until you start falling down and having seizures, because you're always thinking, like brain cancer, you think you're going to have a headache. With ovarian cancer, you're going to think that you're going to be in like incredible, no, you might not even think about it if you're, especially as a woman who's going through monthly cycles, you're like, oh, well, this is just really bad PMS or something.
Absolutely. And at different times in your life, you think, oh, maybe this is what menopause is.
Maybe I'm pregnant.
Maybe I'm pregnant. Yeah, totally. And so it's really just important. I think what we all want is for people to keep aware of how their body is and just follow up when you need help.
So now I have some, what are your greatest fears related to your diagnosis? Or, related to diagnosis.
I don't think I have any at this point at all, actually.
I think that's actually where we were talking about too. It's another thing. Once you've been diagnosed and once your cancer like powers up, or comes back, or what the end game is going to be like, you're like, okay, I could die. Whoop-de-doo. Yeah. I'm here. Okay, so that's the worst thing that could happen is that I die.
I've already been at a point where I didn't have any treatment options left. I was just left to die. That was in March of 2015. And, I thought it was just the end. I went on my #NotDeadYet tour. And
I use the hashtag too. Not dead yet.
Totally. And, you just focus on things that matter. And so for me, fear, I can't control the cancer. Mm-hmm. I do all sorts of things to live the healthiest life that I can and take care of myself and spend time with people I love and be positive. But it's just, you gotta just do it, right?
So, this is one of my favorite things that, are there any things that people say to you that are comments that that bother you or offend you, or just that you're like, no. You just want to kind of be just say something right back at them, not in a bad way, because they don't mean what badly. Is there anything that people say that you're like, try not to say that?
I have 2. One is, I just have learned to be okay with being totally inappropriate in response to this question. So when people ask me if I have children, I say, oh no, I've had ovarian cancer for the 4 times in the last 10 years. you know, because that's my truth. And that's actually my version of having kids. Is basically, this is what has occupied my life for that whole time. And that's why I couldn't have children. And then the second one is actually about other people with cancer. So one of my pet peeves is for people who just had like a one and done, like had cancer, then it got better. And I'm so happy for them and grateful. But there's this weird dynamic with those of us who are advanced or terminal or recurrent, where sometimes those people who had it once are desperate to separate themselves from us.
Like, I'm fine now, or I'm in remission, and it's like, that's great. No, that's great, but like, and often I find in brain groups too, people are like, well, I'm in remission, and you're like, are you though? Like, because with brains, it does. You can say that, and I think some brain cancers, but most of the ones I'm familiar with, they will never say you are in remission because they can't find all its little tendrils and whatnot. You're just stable.
Absolutely. Stable. And like we've learned, I think also the thing that connects me to a lot of people with cancer who I think are really cool, like Molly, are things like we understand that there isn't really good news, there's like goodish news.
There's goodish, there's not worser news.
Yes, not worser. Totally.
Not worser news.
Like, people always want us to have good news, and they're like desperate for us to go to the doctor and have good news. And I'll be like, so I have all these brain bubbles.
That's tiny bubbles. That song's coming into my head now.
And they'll be like, and so I'll be like, so the good news is maybe it's not Mets. Maybe it's not brain Mets. Maybe it hasn't spread to my brain. The also news is that means that it's a separate, totally primary, different kind of tumors.
It's a whole other thing. It's like at some point, with my brain groups too, there's, for every time, everyone in these brain groups is always like, I'm nervous, pray for me, MRI day, that's the day where everyone's like, okay, just fingers crossed, think of me, I'm going in, because that's the day where you find out, and or you generally know at some point one of those down the road, it could be the next MRI, it could be 3 years from now, it could be 10, you're going to have regrowth, and that's something that you have to kind of just prepare for. So there's nothing like having other cancer patients who totally understand. Like, you're like, we'll be thinking about you, but like, there's something about knowing that there's other people in it too. And I don't know if it's just diagnosis or what, but I noticed that I feel like I see more and more people with cancer, but I think it's because my eyes are open now. I don't think there's necessarily more people with cancer. Maybe there is, I don't know. But I think more people are getting diagnosed.
Mm-hmm. Well, and they find you, right?
They find you, find them, they find you. And it's like a club nobody wants to be in, but it's like, sometimes it's like my club. And that's why I can't be totally like, this cancer's the worst thing ever. I'm like, yeah, no, it totally sucks. But I'm living like such a high quality life right now. I mean, like I don't know if I've discussed with you or not, but like I can't fit into my clothes. My face is rounder. I can't lose weight the way I once did. I just can't. I run every day. I run 2 to 4 or 5 miles. I'm getting back into strength training. But I'm not seeing pounds lift off. I am still fluffy. Mm-hmm. And it's hard not to sometimes, like, when things are really good is when I start getting really bummed out about it. Like, when I'm feeling super and everything's great and I start feeling normal again, that's when I'm like, I don't recognize this person. I'm so ugly now. And then all of a sudden you're like, whoa, reverse that. Step back a minute. You are living your best life, like, right now, and you are in complete control of how you can take that.
Yeah, how you think about it.
It's like, it's not that important. It actually isn't that important. And we are down to our 1 minute here, and I want to keep talking forever. So if there's one thing that you would really want to say out there, either about cancer or diagnosis or your mindset, what would it be?
I think I would just say, for me, getting rid of fear is really the best thing. And for me, the way to do that is to understand what can you really control and what can't you. And just make a big list and check off all the things you can control and work on those as much as you can and keep yourself busy. And then the stuff you can't control, you just have to keep letting it go over and over, because it isn't something we can stress about.